Well, good morning, everyone, and welcome again to another live this morning. Hope you're having a great start to your day, and I'll just wait a moment or two here to say hello to a few people, make sure that everything is good, and Claire and Kristen Kristen, Doris, Francine, some new names there. John, how are you? From Elgin, Illinois. Michael from Wawa. Beautiful place. Right along Lake Superior. Okay, and Linda, how are you? Jake, Nick is on with us. Judy, Diane, Carrie. Let me see. I hate missing people. Okay. And John, how are you this morning? Meredith, Anne, and Diane, and Wendy from Markham. Keith, a friend, the Windsor area. Doris, or hold it, is that Don Lee? Yes. And Luke's, and Marilyn from Edmonton. So I think it's Marilyn, right? I think your first name is Luke's. How are you, Lori from Ventura? Good to have you on this morning. Okay, I hope you're having a great day. Today we're going to talk about location, okay? And this is going to be a little bit of a teaching on leaky gut, okay? There are at least 13, probably 1,400 studies on leaky gut. And yet, it's a very difficult for doctors, and I say this in all due respect, to one, even recognize leaky gut, and two, to make a diagnosis. And you have to understand this, okay? I think it's important that you understand this, that doctors' training this is why I said location. You know what that signifies. You know, in real estate, that's a big saying, right? Location. You can have a beautiful house, but if it's in a bad area, your value, or you can have like, for example, Toronto, okay, in Canada or out in Vancouver, you can have a very small house, but because it's in Toronto, it's worth a whole lot of money. It's location. So that's in real estate. And medicine has that mentality. So, for example, if you have rheumatoid arthritis, an autoimmune disease, medicine looks at that as, they understand that it's autoimmune, but they look at the joints and say, well, I've got to treat that. Not looking at the cause of autoimmune, which we'll go over this morning. All autoimmune, all of it, is leaky gut. It's leaky gut. I'm going to explain that. But just understand, when medicine looks at something like this, they don't look at where it could originate from. And that's very important, because you need to understand that any autoimmune and a lot of issues start where Hippocrates said 2,000 years ago that all disease start in the gut. It's that battle. It's the microbiome. Good guys and bad guys. Very important to understand that. And leaky gut has to do with the little lining in your gut. That your blood should be pristine. It's the river of life. Okay, the Bible says it. The life of the flesh is in the blood. You know, in medicine, go back a century ago, even maybe a little bit earlier than that, they did bloodletting because they figured, well, if we can take your blood out, we'll get your disease out. Like, nah. And now medicine understands they have to put blood into your body. You better replace that blood. You can't live without it. But your blood really should be pristine. You got red blood cells, you got white blood cells, and you got platelets. And you would have nutrients flowing through the rivers of your blood vessels 60,000 miles, 1.5 times around the equator. That's how much blood vessels you have. And people don't think of blood so much, and, you know, it's bringing you your oxygen, and it's bringing you your nutrients. Very intelligent, but there should be no garbage in there. But if you have leaky gut caused by, take one antibiotic for 5 days. You'll strip away all your good bacteria in 5 days. Am I telling you not to take an antibiotic? Of course not. I always tell people, look, antibiotics, the greatest discovery of the 20th century, but the curse of the 21st. It's not that they don't work. It's the side effects of an antibiotic. What does it do? It creates what we call dysbiosis, an imbalance. Your gut is an ecosystem. It's an ecosystem. What's happening in California, guys? What's happening there? Why is it in Canada? Why are the forests burning there? It's mismanagement of the ecosystem. It really is. I don't know about the climate, but I know I lived in Northern Ontario all of my life pretty well. And the forest industry is huge here. And I had some very good friends who were in the forest business. You know what they knew? You better do burns, controlled burning, to keep that ecosystem, because if you have too much garbage in there, like, I mean, dead trees and growth around the trees and that, if you don't clean that out and burn it in a controlled burn, you're going to get big trouble. And guys, this is a lot like your gut. When you take an antibiotic, I mean, not just one way, I'll tell you some more, but one of the ways is antibiotics, because they don't know what to kill. They kill everything. They kill your bacteria, and good. If you need an antibiotic, by all means, but you better replace those friendly bacteria. Otherwise, you're going to get an overgrowth of yeast, and that will start a forest fire in your body. Let me tell you that. Candida, yeast, never belongs in your blood. You can have some in your gut. A little bit, no problem. Lots, big problem. And that little lining that protects your blood, there's a barrier there. It's made up of bacteria. It's made up of little cells. It's a little single cell lining that keeps bacteria out of your blood. See, bacteria, it don't belong in your blood. Bacteria belong in the toilet. And if you have a healthy gut, bacteria goes in the toilet. Yeast in the toilet. Viruses in the toilet. Toxins. Heavy metals. Plastic. Never belongs in your blood. Xenoestrogens, they don't belong in your blood. Your blood's supposed to be pristine. No pollution of the river. But that's what leaky gut is, guys. And so what happens with that, what happens is really an autoimmune response. Over a period of time, you can get celiac, listen to what I'm going to say. If you have any food intolerance, oh, doc, I can't eat eggs. Okay, you got leaky gut. Yeah. Doc, I can't have dairy. You know, what are they saying now? Some 60, 70% of kids, they have dairy allergies. It's not the dairy, although there's too much sugar in milk, so... Oh, doc, I'm lactose intolerant. Yeah, but you got leaky gut. You have to understand that. You might have an allergy. Asthma. What do you think that is? Leaky gut. It started in the gut. And we talked about recently Alzheimer's. And a study coming out that, look, there's two ways you can get Alzheimer's. One, insulin. We talked about that, what sugar does to the brain, especially the memory center. But you know what they're finding out now? Alzheimer's. Yeast in the brain, fungus. How did it get there? How did it get into your brain? MS. What are they finding? Yes, they got plaques on their myelin sheet. But how did it get there? Why did plaques form? Leaky gut, yeast, fungus, Parkinson's, fungus on the brain. Started in the gut. So when you have a bad diet, 1, antibiotics, 2, a bad diet, sugar, 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 sugar. Not good. Not good. It feeds. You get an overgrowth. It attacks the lining of your little protective lining. The bodyguards along your gut wall that won't allow garbage to go in the blood. But what happens if they're not there? Chemicals can destroy the gut. So these are important things to understand. Location, location, location. So when I like functional medicine, We want to get at the root because that's very important. It's very important to get at the root of the problem. So let me explain. I'm just going to give you a little bit of physiology. I want to do a little bit of teaching, okay? Just on, okay, so now we talked about the origins of leaky gut. The greatest discovery of the 20th century is antibiotics. The curse is what? Antibiotics. When you take a non-steroidal anti-inflammatory, Advil, over the counter, and I get it, you got pain. Of course you want to take that. What's the problem? It destroys the lining of your gut. That little protective lining. It acts like an antibiotic. One of the things they talked about in aspartame, artificial sweeteners, will destroy your friendly bacteria. So what happens? Okay, so now the lining isn't there, that little protective lining. So we're talking about leaky gut. When the little protective lining is not there, fungi primarily, bacteria, undigested food. So here's another reason you get leaky gut. Because you don't have a good stomach. Your stomach is a furnace. It's a mulcher. As a very acidic stomach will do a job of breaking food down to bite-sized. If it doesn't happen, oh, doc, I got acid reflux. Yeah, I know. Well, I have too much acid. Nah, you don't have enough acid. And now your body overcompensates and starts to make too much acid, and it goes up to your esophagus. And you're, like very uncomfortable. Acid reflux is a symptom. It's a symptom. It's not the cause. It's low acidity, but why is that? Too much insulin. It's your body screaming at you. Change your diet. So substances larger than micro-sized particles get into your blood. That's leaky gut. We talked about the cause of leaky gut, the causes. And now we're talking about, okay, what happens? As substances that don't belong in your blood, they don't belong in there. So your body reacts to them, okay? They get into the bloodstream and they activate what we call antigens, okay? I know a lot of this is big words, but what is an antigen? Okay? So something's in the blood, your body says, hey, what is that? It flags it. You know, your body's unbelievable, fearfully and wonderfully made. Your body's immune system, your antigens, cytokines, they activate. So when you have cytokines, antigens in your blood, your white blood cells, your lymphocytes. Remember yesterday I was talking about T cells. T cells. They look at it as an infection. Something that would ordinarily oftentimes is harmless. Your body overreacts. The T cells go crazy. Your body responds with inflammation. I love Tony Jr. He pegged this years ago. He said, Dad, it's disease without a fever. People in the 1950s and before, even in the they used to die of infection. Not that it doesn't happen anymore. We've seen a virus kill people, and it's not a deadly virus. And I don't want to get sidetracked, but it's not a deadly virus to someone that has a good immune system. But anyway, what happened? Even with COVID, it's in the bloodstream. Body overreacts to it. It's called a cytokine storm. And I was listening to a physician last night who explained that this virus was made in a lab, by the way, in China. Apparently, she's got evidence to prove it, but not the point. Another physician who came on just after her said that in his treatment of COVID, for example, what he saw, unlike any other virus before this, is the storm, what they call the cytokine storm. Your body overreacted to it. The immune system went crazy, especially in the lung area. So older people who were vulnerable, their body went into what they call a cytokine storm, inflammation big time. And that could get into the lungs. But that's what autoimmune is, guys. Autoimmune is the body's overreaction to debris in the bloodstream coming from, remember now, the gut. Primarily, it's fungi, it's fungus, it's candida, it's yeast. The most common candida is Candida albicans. Oh, don't you love Latin? Why don't they just call it yeast? Everybody understands yeast. You need it to make bread. It goes whoop. It expands. It permeates everything. That's the problem when it gets into the bloodstream. So when when someone has crippling rheumatoid arthritis, it started a long time before that in the gut. Maybe even they were set up for it as children. When they started taking antibiotics for ear infections. I'm a history taker. All my practice life, I was asking questions. My son-in-law, an emergency physician. I saw an advertisement last night. I got to get it because it just had me laughing. 1-800-SAM. My son-in-law is a physician, and I call him 1-800-SAM. But he said something that's very interesting. He said the biggest thing is asking questions. I'm asking questions. I want to know your history. Because it's very important. You just didn't get rheumatoid arthritis because of genetics. Genetics has very little to do with autoimmune. I mean, it makes you more susceptible. But you need to start it with leaky gut. Otherwise, it doesn't occur. So leaky gut, see what I was saying by location. Doctors see arthritis and they go, okay, I need to put you on steroids or prednisone or anti-inflammatories and sometimes even chemotherapy, methotrexate. I get it. They're treating the symptoms. But you better get at the root. The root is in the gut. And unfortunately, we don't have a little light on our head that goes, leaky gut, leaky gut. There's yeast, there's fungus, there's garbage in your blood. It don't belong there. Wouldn't that be nice we had that little thing there? That's how it works, guys. Your body's overreacting to it. A cytokine storm. And inflammation is, we know, inflammation really isn't at the root of disease, although many doctors think it is. Yes, it's involved. It's very involved. It's the destructive thing. But why inflammation? Why? You see, leaky gut, we have the trinity of disease at the Martin Clinic. Tony Jr. and I, years and years and years, we talk all the time. And I pick his brain and he picks mine. And we talk, and I remember we were having a powwow. Can I say that today? Is that offending anyone? I hope not. No, but we were having a session. We were working on a webinar, and we came up with this. Look, I know inflammation's involved, but and then we us, we've always talked about food, and that's insulin. It's too high, it creates inflammation. Yes, food. And we knew the other one was leaky gut. Leaky gut. So you have location. The gut is the originator. And your brain may be one of the locations that leaky gut will affect. It may be your joints. We talked last week, I believe, on a previous episode. We talked about the kidneys. Leaky gut, leaky kidneys. Leaky gut, look at guys, anything on your skin that doesn't belong there. From acne, psoriasis, eczema, dermatitis. Name me the skin. You have to go back to the gut. Your skin is just a visible organ. And for sometimes, it will display what is going on in your gut. Leaky gut, leaky skin. Leaky gut, leaky joints. Leaky gut, leaky brain. Here's another one. Lungs. Leaky gut, leaky lungs. We talked about fat, so that's insulin in the lungs, right? Fatty lungs. Fatty tongue. So that's insulin. We talked about that. But one of the big problems in the lungs is yeast. It's fungal. But fungal didn't land in the lungs before it was started in your gut. Sinuses, chronic sinusitis, leaky gut, leaky sinuses. Oh, doc, I'm always stuffed up and I have allergies to the environment. Why? leaky gut. It didn't start in your sinuses. It started in your gut, went into the bloodstream. Leaky gut. Isn't that incredible? So that's why it's so important. It's so important. You want to get at the root cause. And one of the things you want to do, for heaven's sakes, if you got yeast, fungus, candida, don't feed the bears. Don't feed it. Don't give it sugar. Yeast's favorite food is sugar. Don't feed the bears. Nada. None. Not easy. I get it. Because yeast will call your name every day. It will say, "Oh, Susie, I need to be fed. I'm your little pet inside your body, and I want to be fed. So give me that chocolate. Give me that sugar." You want to know why you get cravings? Your yeast is calling your name. Your little pet inside your body, it's a beast. It's not really a pet. It's out to bite you, to make you unwell. The brain, the lungs, the heart. It's systemic. Incredible. The skin, the sinuses, the joints. So that's sort of leaky gut in a nutshell, guys. It's at the root. And I mentioned this to you several episodes ago, that yeast or fungi, according to some doctors, is at the root of every cancer. Upon biopsy of the cancer, they see fungi. Where did that come from? The gut. Yes. Rinse and repeat. Rinse and repeat. That's why we're so big on probiotics. What we know about the gut today. Incredible. It's incredible. But again, medicine, and I don't want to be negative, but they often miss it because they're not looking. They're not looking at the root issue. They want to treat the symptoms. You got sinus problems? Oh, lady, here's another place. I just got to tell you one more place. Especially you ladies. Leaky gut. Leaky bladder. Oh, doc, I got a urinary tract infection. Okay. Do I take it? I got to get an antibiotic. Okay, I get it. If it's really painful, then get an antibiotic. But don't take it for 7 days. Because that's what it says on the label. Take it for 1 day. As soon as the pain's gone away, stop it. And double or triple up your probiotics. Why? Because it's yeast. There may be a little bit of bacteria there, an E. coli or whatever, but it's yeast along the lining, and ladies, you're famous for it. I don't have to tell you ladies about a yeast infection. You know what that's like in your privates, but what if it's in your bladder? Well, guess what? It's fungus. The bacteria just happens to be there. But when you get rid of the root issue, and it may take, listen, this don't happen overnight, by the way. Because people ask me online all the time, how long should I take my antibiotics? Well, check your pulse. You're still alive? Take an antibiotic. Excuse me, a probiotic. We changed our mind years ago. You know, we used to say take it a couple of times a year. Not anymore. Nah, the more we know, the more we know, the more we know. Probiotics, probiotics, probiotics. Broad spectrum. What's that mean? At least 10 different strains. Why? Because you need to, different strains do different things. Some go after the candida yeast. Some are anti-inflammatory. Some do this. They're like tribes. They love different places. So, leaky gut. Tomorrow, might talk a little bit more about healing the lining of the gut. We'll see. I've got a couple of other good teachings I want to do. So we'll talk. We'll see. I haven't finally decided. Okay. So any questions for Friday? Send them in. Okay? And sometimes, look, if I don't do it on Friday, it's not because I don't love you, okay? It's not. I try and answer every question, but sometimes you ask me a question about an individual little thing that may be rare or whatever, and, I'd rather answer you personally than answer online. But listen, send it in, okay? Don't be shy. We want questions. Plus, if you're not a part of the Martin Clinic Facebook group, the private group, please join. Next week, just about official now, I think. I have to wait for the boss. We're going to do a webinar. Be fascinating. So anyways, you're going to get an email about that. Or it'll be put on the Facebook group, how to join us. It looks like it's going to be next Wednesday night, I think. Okay, like I said, I'm not the boss. Okay, love you guys. Talk to you soon.